So we do have quite a few questions that have been sent in. And I would like to start out with one for Tunç. How would you design a study that compares the effects of stem cells versus exosomes?
Well, I mean, it is really hard for me to comment on that, but basically what we know is exosomes are the information media with which the stem cells act, basically. So stem cells are the factories of, let's say, constructive exosomes. Now, if you compare a single injection or a single treatment of stem cells versus a single treatment of exosomes, I would rather choose stem cell injections, because what we do there, we are injecting the factories. They continue like sending out exosomes continuously for the coming 3 to 4 weeks until they go back to sleep, right?
Right.
Whereas if you have a way of treating continuously with exosomes, probably that would be much more potent, because you literally like give the message, you give the orders. You see what I mean, basically?
Right. We have a question from the audience. Is the source of exosomes important in treatment type?
I mean, let me answer from my side. Absolutely. Actually, this is the most important thing. Now, you know, or we know, exosomes can be divided into two main groups: the destructive exosomes and the constructive exosomes. So depending on the source, you will get some of them more in number or in percentage. If you are injecting embryonic or fetal exosomes, or exosomes from a young stem cell culture, the majority of the exosomes you inject are going to be constructive exosomes. Whereas if you are using exosomes from a senescent cell culture, or older people or older animals, they are going to be more on the destructive side.
Thank you. There's another question that reads, when using exosomes for post-care with lasers, plasma pen, or microneedling, how many vials of the product do you use? And do we send them home with it? Yes. How many days after treatment do they continue to use it to help heal at this point? And this is for post-treatment. So this is from Sheris Patton from the US. So Dr. Patton, this is a common use for me, and I will combine the Benev product, one vial, into the Aquaphor, which makes up the exosome balm, the recipe that I gave you. And this tends to last them for their entire post-care regime. I have them use it twice a day for at least 5 days until their skin is fully regenerated and fully epithelialized. So basically it's one vial for 5 to 7 days post-treatment. And the cost of this is about $100 your cost. The next question, I've had somebody inquire about the use of enzymatic therapy. Steve, Tunç, Dr. DeFelice, any of you use enzymatic therapy?
I'd be happy to talk about that.
Yeah.
You know, that's how we started out. So I think Tunç and I, back in the early 2000s, began using primarily enzymatically derived stromal-vascular fraction. I've done it in a couple of FDA studies. And early on, we treated patients under an IRB. At this point, based on two things. One, the fact that this has been a struggle to get through the FDA. And so there's, you know, obviously a lot of surveillance. And although I have no problem with using enzymatic SVF from Cytori's device, because the FDA has also approved intracardiac use through their studies. So safety to me is not an issue, but because we've been able to come up with mechanical ways of producing equivalent amounts, and that these cell aggregates may actually turn out to be more effective, there's to me, other than for intravenous use, there's really no reason to be using an enzyme because you're going to get, for instance, with a device like LipoCube, we know now that we get almost an equivalent amount of cells with similar types and behaviors as we get from an enzyme. And in fact, with scratch tests, they perform even better. So I don't see any reason to use the enzyme unless we're thinking about intravenous use for, post-COVID symptoms or other more systemic diseases.
Maybe I can add two things, Steve, if I may. Now, with the recent developments in the mechanical isolation systems, as you know, we are getting nearly similar cell counts like the enzymatic digestion. So basically, then there will be only one indication for enzymatic digestion, as you said, which is when we need a purified stem cell suspension. And that would be for the IV use. Except of that, I think we are already far ahead with the mechanical systems, I would say.
Thank you both. The next question is, how about the cost benefit between exosome and PRP? Dr. De Felipe, what do you think? Do you use PRP much, or have you switched mostly to exosomes for your hair treatments?
Yeah, thank you, Diane. Well, we are using a lot of PRP in alopecia, not only in androgenetic alopecia, but also in alopecia areata and other kinds of alopecia. But we have done this study comparing not only C-line versus exosomes, but also PRP against exosomes. And what we saw, and this study has been sent to the British Journal of Dermatology to be published, what we've seen is that PRP increases the thickness and the density of hairs, but not as much as exosomes. So the benefit is clear on the side of exosomes. The cost is not really much different. So I think that the cost benefit favors the use of exosome against PRP.
Thank you. I would agree with that. I think that in my experience, which is much more limited than yours, I've seen such an increased benefit with exosomes that even with the product that I've used, which that particular product is quite expensive, it's $2,500 per 5 cc's. And the Banav Exicobio one is quite a bit less and more affordable. I would say that the results with exosomes definitely make it a strong cost benefit. There is a question about, have you ever used exosomes for stretch marks? Any of you?
I didn't.
I've had a couple of patients that I've had some limited improvement with, but I would say this definitely would be a study, and you would have to do microneedling and application probably more than one time, especially for people who have pretty severe stria. So your Turkish colleague, Dr. Gumas, we hope that you will try a study for exosomes on stretch marks, because that's definitely a niche without a good answer. So thank you for that contribution. Dr. Chatterjee from India wants to know, is there any control on regeneration? I'm not sure exactly what that means, any control on regeneration. Maybe you can send in a clarification. There's another question from the US. If it's autologous and from an older patient, how effective will that be? And I would tell you that in my experience, I showed a picture of the 58-year-old person at the beginning of my presentation, and I used autologous nanofat and autologous fat from her, and she got quite a good, effective result. I think Dr. Cohen has had a little bit of a different experience, but I think you still, Steve, you still get great results with autologous fat from older patients. It might just not last as long. What are your thoughts?
Yeah, I think, you get similar effects, but I think exactly when we looked at patients over 55 versus under 55, at least from a volume effect, we saw that it trailed off in the older age group so that at 2 years, only about 30% improvement in volume was noted versus the other group, which had a rebound effect and almost were 80% improved volume. And this was looking at multiple regression analysis where we factored in any weight change, we factored in BMI and any BMI change, and we factored in the amount of fat initially grafted. And irregardless of those, these curves remain statistically significant.
Excellent. That sounds helpful.
So
Tooch,
definitely
oh, go ahead, Steve.
No, I was going to say, I think when we're talking about regenerative medicine and we're talking about using, autologous products, younger is going to be better. I think as we start to realize that we can manufacture certain things from more youthful tissue, as Tunch was talking about, we'll have a steady source.
I agree. So Tunch, here's a question for you. What is the relationship between exosomes and cancer? And I think this is an important question.
Yeah, that's a very important question. Now, I think, well, basically, I'm not a basic scientist on exosomes, but I mean, as far as I know, there are two sides of the story. It is a two-sided blade, basically. One of them is because we are sending in genetic information, although it is mostly in the form of RNA, we will not be able to 100% sure what it will do, whether it is going to be reverse transcriptized, whether it's going to be incorporated into the DNA of the cell, of any cell. That's what we don't want. We don't know. The other sharp side of the blade is if you increase the constructive orders too much, then those cells might get rouge and they might become really immortal. And that is exactly what we don't want. I mean, we have to walk on a very narrow path where they do not go into senescence, but they do not ride into immortality, because immortal cells are cancer cells, simply. So we have to keep them on the balance. And there, we don't have enough information about the doses of the exosomes, what we use, and also about the ingredients. That's why I think harvesting the exosomes from young sources is the safest kind of like guideline for us, because young cells or youth is not harnessing cancer cells.
Correct. And I think the limited study that I've done on tumorigenicity and exosomes shows that there's not any direct link and clear link between the use of exosomes in the promotion of cancer. But I think it really depends on the genetic expression of your exosomes and the targeted direction. And I see this as definitely something we'll go for in the future. There are some cancer cures with exosomes, like I mentioned, the dendritic cell tumors, and they're working on some influencing of breast cancer as well. And so it really depends on the interaction of the exosome with T cell and B cells. And I think that's something that is ongoing study, but there's no definitive answer for that yet. I have a couple of questions for Dr. De Felipe. One, how effective is the exosome treatment without accompanying drugs such as finasteride? Dr. De Felipe?
Yeah, this is very interesting. Well, the study had to combine exosome together with oral drugs to have the approval of the ethical committee of the hospital. But obviously, we have tried also this treatment alone without oral drugs, especially in patients that could not have this. And there is a very strong response to exosomes, right? Obviously, this has not been a part of the study because it didn't receive. And as you know, exosome use in Europe needs a hospital authorization. It's not a common drug, right? But it is very effective. In response to this question, exosomes are very effective in the treatment of hair alopecia.
And there's another question, are exosomes more like a maintenance treatment for androgenetic alopecia? After your study, do you plan on, say, having your patients come back and treat them with a yearly exosome treatment for maintenance, or do you have a program for that yet?
Yeah, we have a current study where we are injecting these exosomes every 3 months, and the patients are continuing the oral treatment. And there is kind of a plateau that is reached at about 2 years or 24 months after starting the treatment, after which the hair density does not increase. So yes, there is a maintenance treatment that we are doing every 3 months.
Perfect. Are you finding people come back for that they want to maintain their result?
Yeah, so there are two types of people that have responded very well at this first course of 6 sessions, and also people that have forgotten their treatment for 1-2 years that come back because they see and we can measure a loss of hair, and they recover that loss of hair with sessions that are done every 3 months.
Perfect. Steve, there's a question. Can you add lidocaine to exosomes for pain management? When you're doing your intradermal injections, do any of you have any experience adding lidocaine, or do you think that this would inactivate the exosomes in some way?
Yeah, we always add a little bit of lidocaine in our study, and you can see this when the paper is published, definitely in the British Journal of Dermatology. A little bit of lidocaine is added to diminish the pain, especially after the treatment. When we do the injections, we use a small device. It is, I found it in America. It's the Blaine's something. It's a vibration system, and it makes the treatment very comfortable for the patient.
Okay. And what is your concentration of lidocaine to the volume of your exosome injection?
It's 0.5 of the 2% mixed with 6 ml. So that means that the concentration is about 0.05 or something.
Okay. All right. So that's not very concentrated.
Very diluted.
Okay. Here's another question. Customers generally expect some results with injection products. Therefore, when it comes to exosomes, they're treated through regeneration, which takes some time. Does it take a long time to be effective? These particular people had used mesotherapy applied directly after laser, but 1 to 2 times the treatment, no obvious treatment improvement is seen. Why is that? My experience has been totally different. I've seen immediate results within 24 hours. So it may be that the product is different or your application is different. As Tunch pointed out, the exosomes are anti-inflammatory, and definitely, I think that's one of the main ways that it improves healing, is that it's anti-inflammatory. So for patients who are having injections or medical aesthetics, I would say maybe you should add some microneedling, non-thermal, because that has no downtime. And my non-thermal microneedling, unless I'm doing hair, is basically only 0.5 millimeters, and therefore you don't need any lidocaine because it doesn't hurt. Anybody else have any solutions for that question?
Yes, I'd like to comment one thing about the results. We know that the cycles of hair are very, very long on the scalp. They're about 3 years long, and the telogen phase is usually about 3 months. So we never expect results before 3 months after starting a treatment. And this is what all patients know.
Thank you. There's another question, and this one's is for Tunch, because I know you and I already know the answer. Is there any FDA or EMA or PMDA approved exosome in the market?
Okay, that's well, I mean, FDA is having jurisdiction on some topics, and it doesn't have on different topics. So if you would be talking about an autologous medical device system harvesting exosomes from the patient's own blood, meaning if like an extreme concentration of a PRP suspension, that would be possible. That would be a class 2 FDA medical device, which is not on the market yet. If you are talking about a cosmetic product, which can be used even with a dermabrasion off label, that is possible to use as well. So you can have a cosmetic product without any FDA approval, because cosmetics are not under the jurisdiction of the FDA. And that can be an off-label use of intradermal dermabrasion. It can be a topical use whatsoever. If you are talking about GMP products, which is currently the case in the United States, then the ball is on your lab, Diane.
Well, and I'll just reiterate that the FDA categorically does not approve exosomes for any use. Although there are a couple of companies with INDs for ARDS, to date, there is no approved use for exosomes. So I would recommend that you either do like Dr. De Felipe did, if you're thinking about injecting, do it under an IRB approved study, or use it topically. And the last question that we have time for today is one for Steve Cohen. How about doing topical plasma and exosomes with microneedling?
I see no problem with that. Again, I think, you're just delivering more of the same, because topical plasma is going to contain exosomes, and, you're adding now exosomes in addition. So to me, generally higher doses of these products have been more effective. So I don't see a problem with that.
All right, thank you very much. It's time to close our session today. I wanted to thank Exico Bio and Benev again for their generous contribution to sponsoring this webinar. Thank you very much for attending, everyone.
Diane, thank you. Steve, thank you. Felipe, thank you very much.
Well, fantastic.